Hi, Anthony. Okay, you are watching the Stream Home Edition. There are so many times when the streaming team asks, what show would you like us to do? What issue is important to you? And today we're doing exactly that. Take a look at my laptop. So many of you asked if we could look at the coronavirus in Bangladesh, and this is by popular demand. For instance, here's Syed Ismail, and Syed says that coronavirus situation across Bangladesh is increasing. He's really keen to know about how much testing is going on, how successful that is. If there was more testing, would the figures for COVID-19 disease in Bangladesh be so much higher? I know you have questions as well, and the YouTube comments chat area is absolutely open for you to ask your questions to our guests. They cover medical, they cover business, they cover innovative, and they also innovation, and they also cover the government as well. So a really excellent panel. Let's meet them. Hello, Rubana. Please introduce yourself to our audience.
Hi, I'm Rubana Haq. I'm from Bangladesh. I'm the president of the Bangladesh Garment Manufacturers and Exporters Association.
Good to have you. Hello, Dr. Rana. Dr. Rana, please introduce yourself.
My name is Dr. Anjang Rana. I'm the representative of WHO to Bangladesh.
And Anir, good to have you in the conversation. Tell everybody who you are.
Hi, I'm Anir Chaudhary, Policy Advisor of the A2I program of the Government of Bangladesh, being implemented by ICT Division, Cabinet Division, and supported by UNDP.
It's really good to have you guests. Good to have your YouTube in the mix as well. Do utilize that comment section. But I want to start not with figures for Bangladesh, but with the people of Bangladesh. So there is a factory worker that Reuters News spoke to last week, and he was back at work, and he was very concerned about that. Let's have a listen.
Our appeal to the Prime Minister is that while all the governmental and non-governmental organisations remain closed, why are we working without protection, working alongside hundreds of other people? Can't we get security? Does our life have no value? Don't they have any responsibility for us? Are we not human beings?
Rana, that's such a good question. Do you want to try answering that? Why are some people working in Bangladesh right now? COVID-19 figures of the disease, the cases that you actually know, are going up.
Actually, no. The cases are actually not that bad anymore. It's not even going up to the point that we really thought that it would go up to. So I think there's a general misunderstanding about how it's being handled in Bangladesh. One, export sector was actually never disallowed. Export sector was allowed. Therefore, I think what mattered to us most was keeping the economy alive and rolling with the maximum safety guidelines in place. So we just barely opened up on the 26th of April, and that opening phase was also limited. So we literally insisted on 30% opening, but you have to understand that it's a huge sector. So a factory which has 18,000 workers, opening up with 9,000 or 50% is still a lot. So within the factory, while we tried to at least maintain low density for workers, at the end, we don't have any control of where they come from or how they travel to work. So we insisted to start with that we wouldn't have workers from the villages, and that we would only work with workers who were around the factory spaces. So we tried our best, and so far we've been very.
So Ramana, I'm a little confused about this, because there are many places around the world where they're suggesting that you shouldn't go to work. I'm showing here something from your feed, your Twitter feed, and these are workers going into what looks like it's a factory. They are having disinfectant, they're going in, masks are being worn. Dr. Rana, is this a safe situation right now in terms of people in Bangladesh going to work? Are we in a post-lockdown situation? Is it okay?
Thank you, Femi. I mean, it's very obvious that, the social and economic dimension of this crisis has to be looked into. So every country, not only Bangladesh, every country is looking into this. So I would not say that Bangladesh is the only one, and they're all exploring the fact. But it's also, we need to keep in mind that anybody who's going to work needs to
In
be in a
countries
safe
like
environment.
Bangladesh, coronavirus pandemic.
From the
Sorry.
WHO's perspective, what would you be thinking in terms of, Bangladesh, you're head of WHO Bangladesh, what is your best advice for workers, knowing that there is pressure economically to go to work, but in terms of health and maybe cases? And Rana says the cases are not as much as you expected them to be. I'm looking here at this headline here for the beginning of May. Bangladesh coronavirus cases exceed 10,000. That's from the Health Ministry. Be candid, Dr. Rana. Should people be mixing and going to the office, going to work, going to the factory?
The country has already given a note verbal for shutdown, I would say. And that, I guess, as of the note verbal of today, has been extended to likely 16th of May as well. So they have definitely some reasons to do that. The cases have been reported fairly, every day. The case is now reporting 500 and above. And the Director General of Health Service has announced it as a community transmission of the country, putting all district at risk. So definitely these are this. But however, at the same time, the note verbal has also mentioned that they are looking into some areas that they are looking.
So, Dr. Rana, just help me out here. I'm living in a village.
Yes.
I really want to go back to Dhaka and work in a factory. Just be honest with me. Should I be going back to work right now?
Dhaka is still the epicenter of the.
You could say yes or no, doctor. I just want to be very clear what you really think the advice should be.
Well, I mean, if at the moment with the.
Okay. Anir, come in and help Dr. Rana. Go ahead.
Sure. Yeah, I think it's not a yes or no question, Femi. So, I mean, when the advisory across the world, the standard advisory is health first, I would say it has become food first for the people in Bangladesh, as in the people in many other developing countries. So when it becomes food first, the immediate nature of hunger, when you're looking at the faces of your children, when you actually have family responsibilities, the daily wage earners, the construction workers, the rickshaw pullers. So we have been under lockdown for a number of weeks, since the 26th of March. So it's been 6 weeks or so, and we have extended the lockdown a number of times. The most recent one today till the 16th of May. So for the daily wage workers, it's a very, very difficult situation. So health first, where I may not get sick, I may not die even if I get sick. I may just have mild symptoms, which is the case for 85% of the cases. So I will take that risk. I will actually go out and earn a living, because otherwise hunger means death for me and my children. So I think that's the reality we have to also contend with. It's not just the health first advisory that can keep me at home. So there is popular demand.
It's complicated. I'm pushing for a, should I go to work? And you were saying it's a lot more complex than this. I'm dipping into YouTube, because YouTube has got a lot of questions for you. Ashik Islam asks, it's unusual to see what Bangladesh government is doing in this current pandemic. I don't know what they're thinking at this moment. Why are they opening populated sectors? First of all, Anir, is that true?
Well, depends
Shall I
on what
answer?
populated sector really means.
I'm going to do Anir first, because he works with the government, and Rubana, then you can come in second. Anir, go ahead.
Sure. So depends on what populated sector really means. The schools and all the education institutions are closed for the foreseeable future, potentially up to September. Shops are opening up a little at a time, a few at a time. And given that this is the month of Ramadan, Eid is coming, so we are opening up some of the shops, only a few at a time. The factories, again, as Dr. Rubana Haq mentioned, again, some factories have opened. The pharmaceutical factories have been running almost non-stop to supply the medicines and the healthcare items. Factories for garment workers are opening up. Again, a few at a time. I think I've heard about 1,000 or so that has opened up. And the social distancing or the physical distancing is being maintained as much as possible. So it is risky. I will not say that it is not risky, but people still have to work. The government is trying to create a new social safety net. So about 50 million households are actually now going to have about 5 million. Sorry, 5 million households will have the new social safety nets for the next 3 months. So that will help many of the people, but still the people who may be left out, who may not find that enough, will have to work.
Rubana, some questions for you, and the people are really concerned about what's happening with some of the garment industry. Yaz, for instance, on YouTube. Hello, Yaz, thank you so much. Health experts are raising the warning of the haphazard opening of the garment factories. And Yaz is saying that this could be another Rana Plaza, which was a disaster for the garment industry, but that was because of a building collapse. But this is seen as another kind of disaster. This idea that COVID-19 could be a disaster for people if they stay away or if they go back to work. Rubana, go ahead.
I think Onir also made it amply clear that 85% would not. Number one, many are asymptomatic. Number two, I don't think more than 80% actually will not be critical. So I think less than 5% would be. In that case, so far in garment factories, we have opened up since 26, and we've so far had 12 identified cases, and we are now working towards creating an isolation center, bringing in PCR units, PCR labs. So I think it's important for everyone to realize that there's a stark conflict between lives and lives. And economy must go on. We must do what we can do. And I think the conversation should not be about us getting back to work and being not careful. It is because the West gives us no choice but to go back to work. If the Western buyers stayed up, we would at least have the money to pay our workers and just sit tight. We couldn't do that. We couldn't export 50% of March. So I think the moral bar should not be applied in our case, and I think the conversation should absolutely turn towards the Western buyers.
I hear you, Rubana. You're saying don't judge us because we don't have the money in the economy to be able to survive.
We don't have choice. We don't have choice.
There's no choice. We're going back to work because we don't have any choice. You made that very, very clear. Let me just bring in Mutasha Kabir. She is from an organisation known as BRAC. BRAC supports people with very low incomes, supports the poor, helps them to get out of poverty. This is what she told the stream earlier. Have a listen.
In countries like Bangladesh, coronavirus pandemic is not just a health crisis, it's a humanitarian crisis with far-reaching economic impact. A BRAC survey shows 14% of low-income families in Bangladesh do not have food at home. More than 70% have lost their income source of livelihood. There's a huge trend of people migrating from urban slums to the villages because they cannot sustain themselves. As a result, aside from the already extreme poor, we see a new segment, a new poor segment emerging whose life have been hugely impacted for the pandemic.
Dr. Ron, I want to bring you in here because I looked at the WHO Southeast Asia Twitter feed and I saw something that I was never ever expecting to see. Having done as Al Jazeera a number of stories, many stories about Cox's Bazar, the Rohingya, to see this testing station at Cox's Bazar, sample collection to diagnosis in laboratories, WHO supporting testing for COVID there. And you can see that early detection is a key to initiate a timely response to protect this vulnerable population. There are multiple vulnerable populations in Bangladesh, but two in particular that are refugee-based. One is the Rohingya. Dr. Rana, talk to us about the Rohingya and what might happen if they were impacted severely by the coronavirus.
Thank you. Yes, I mean, you already know Bangladesh is the most densely populated country, and within that itself, they have a Rohingya population, who are refugees who are staying in a very small area, and therefore, any communicable disease, not only COVID, but any communicable disease would be quite devastating. We've had a number of outbreaks there already earlier on, like measles and diphtheria, but those were able to be controlled. Yes, there has been a lot of preparation done by all the UN and international donors and partners in trying to ensure that the facilities are ready, because until now we have no case of any COVID within the camp, and this is trying to maintain that as much as possible, really putting up very low footprints inside the camp from outside. Very essential peoples are now only allowed inside the camp. Health, food, these are very essentials, and they're trying to keep this at that level as much as possible. But at the same time, doing a lot of preparation on isolation facilities, treatment facilities. Trainings are ongoing. However, of course, being such a large population, there are still challenges, if it goes really big, we need to get prepared for that. So there is a little bit of challenges on ensuring
Dr.
experts,
Rana,
human
am I thinking,
resources, and
sure, am I right in
yes,
thinking
please.
it's 1 million Rohingya refugees in Bangladesh? Did I
Yes,
get that figure right?
just under
So
1 million.
high density, that's incredible. Anir,
Correct.
do jump in,
Correct.
because I know this is something you are deeply concerned about as well, and you know a lot about that.
Well, as Dr. Rana pointed out, there has been no infection, which is a really good news. So any infection can get very serious and catastrophic because of the density and because of the complete impracticality of any kind of physical distancing that can be maintained there. So the good news is that we have no infection right now. It's a lockdown within a lockdown. So the camp has been in lockdown for many months, and we're trying to maintain that. So only essential people are going in and out. People are concerned within the camp about potentially food shortage, potentially medical shortage, but that hasn't happened yet. So I think the government is trying to put a very close eye to make sure that the basic necessities are all fulfilled within the camp.
Oh, Anil, I'm going to just throw this to you straight away. This is Faisal. Faisal, thank you for being in our YouTube chat today. He talked about the conditions of the Rohingya refugees in the camps, and that they are not good, and also mentioned the internet shutdown around the camps of refugees. Now, you are a tech guy. You know about digital. You know how important it is to have connectivity. Is this a time, do you think, when perhaps that mandate, that idea of not having internet, maybe that should be lifted right now?
Well, internet has been a concern in the camp, and it's been shut down for a number of months. So it's not around the COVID situation; it's actually a pre-COVID situation for a particular reason.
Indeed, but I'm wondering if now is a good time to actually ease that up so people can be educated, they know how to social distance, all of that information that we share online.
Right. So I think that is an interesting idea that we can consider. As you know, we have been using the internet and phones, just basic feature phones, to isolate cases. We've opened up a hotline called 333, which we have repurposed. It used to be used for different purpose. Now we have opened that up for triage, so people can call in, report symptoms. We've had about 5 million calls in the last 6 weeks or so. And we are using those calls to identify the high-risk cases and also the disease clusters within the country. We have been able to identify disease clusters within Dhaka, within parts of the country, even before testing was done. So it is a very good and relevant use of technology right now. And we potentially could explore whether the Rohingya population could use that technology as well. So that's a very good suggestion that we can explore right now. Thank you for that.
And also, we were talking about so many challenges for Bangladesh, but we haven't really talked about some of the ways that Bangladesh is perhaps ahead of other countries. Telemedicine, and also asking your doctors who are over a certain age to actually do telemedicine and not go and do visits to potential COVID-19 patients. That is different, Anir.
Absolutely. So as I got the call from the DG of Health Services on the 8th of March when the first death occurred, we jumped into actions with technology, with a very large force combining many different companies and NGOs. And BRAC, you heard from Motushi, so BRAC is also part of the workforce. We realized that a lot of the people calling into the helpline, 333, they needed medical help also. So not just to report their symptoms, but also needed to talk to doctors. So we overnight created an e-learning platform which trained about 15,000 doctors on COVID issues. And 4,000 of those doctors are now part of this Uber pool of doctors. So as soon as anybody calls in, any of the available, just like an Uber driver, an Uber doctor, gets the call, and we have hundreds of doctors available in the middle of the night as well. So out of these 4,000 doctors, and they provide telemedicine help, provide prescriptions, and people are benefiting without even visiting doctors. Also, the DG Health recently issued an order that any doctor over the age of 50 will primarily treat using telemedicine because they are at high risk.
Sure.
We already have over 550 doctors infected, 2 of them dead. So there is that issue that we are also dealing with. So doctor safety and people safety as well.
Yeah, because the medical professionals, as in every country, are now on the front line and they are taking many losses. That would mean, Dr. Rana, that you would just have to work from home. You wouldn't be able to go and work with patients. Dare I say that I think you may be slightly over 50. All right, let me just move on just a little bit, because this is something that Rabana brought up. And the YouTube audience, Rabana, are getting quite upset with you because of the way that you're saying we need to get back to work. There's no choice. I want to bring into this conversation Aruna Keshav. She's a senior counsel for Human Rights Watch in India, and she talks about the ethics of what other countries are doing in terms of business with Bangladesh. Let's have a listen.
The way in which this crisis has unfolded in the garment industry has once again exposed the brute commercial power that brands and retailers have over suppliers, and how they exercise it, as many have in the industry, to cancel orders with complete disregard for what this means for workers' livelihoods. The only way in which this can be rectified is if there are strong and effective regulations that rein in the unfair commercial practices of brands, as well as enforce the human rights responsibilities of brands in their global supply chains.
Rubana, is there a way that other countries who normally do business with Bangladesh, they could be helping right now?
I'm not sure about your question. Number one, what exactly do you mean? What about other countries?
You said that the blame game was actually on the shoulders of the countries who perhaps were not doing business anymore. They hadn't paid for orders that they already put in. You brought that up.
Right. Okay. So Aruna is actually very, very aware of what's happening with us, because we've been opening our portals of cancellation to Aruna as well. So they're very aware of what's happening in Bangladesh. 99.9% buyers have literally told us that they're canceling. So number one, orders which were produced are being canceled, which are in process, so WIPs, those are being canceled. And also, of course, which goes without saying, the raw material which is unused, unutilized, are also being canceled, which are all paid for. So when this happens, the country basically plunges into a serious state of gloom, because 84% of the economy depends on garments, and there are 4.1 million workers here. And nobody's going to feed them. Bangladesh pays $423 million for wages every month. So that is a huge, and nobody can afford. I mean, if you ask our workers, you probably asked a few, you ask them now, they're dying to get back to work because nobody wants uncertainty.
And then some of our audience is saying they are dying if they go back to work, Rubana. I am going to wrap up the conversation for now.
I think it's a very populist statement,
but
because
Rubana,
the death rate in Bangladesh is not that high.
I know Rubana hears me. I'm just going to say, Rubana, thank you very much for being in this conversation. Dr. Rana, thank you. Ania, we appreciate it. It is a very difficult situation for Bangladesh and many other countries. Thank you for helping us unpack the dilemma that Bangladesh has. We appreciate your pitch as well. Thank you, YouTube. I will see you next time on The Stream. Take care.